The U Clinic is our bold vision for what we believe healthcare can truly be. We believe every patient deserves more than just medical management. They deserve a journey, one that's seamless, empowering, and deeply personal from start to finish.
At the U Clinic, we're redefining how healthcare is delivered. So instead of the traditional models where the patient goes to separate healthcare providers and are serially seen, we're going to change things. We're going to put the patient right in the middle. And then as and when the patient needs our expertise, we can dip in and out. And I think that's going to completely revolutionise the entire patient journey.
Much like we've done in our Oxted clinic, we really hope to embed and be a foundation of the Sevenoaks community and the surrounding population through high quality healthcare, trusted professionals, and good value care. We hope to deliver care for you and your loved ones, not just now, but forward as their entire health journey. You have trusted us with your health in Oxted, and we hope to do the same here in Sevenoaks and the surrounding areas. Your health and your loved one's health is so important to us. We want to provide the highest quality care for you and your loved ones, working as a team, as my colleagues have said, to ensure that your health journey, not just today, not just tomorrow, but for long term, is looked after by the U Clinic team.
Our hope is that this clinic becomes a space where health isn't just treating illness, it's about nurturing whole health. We are so proud to start this journey with you.
The ones that you're really concerned about, such as this one which has got darker clearly over the time period and has grown, you can use our demoscopy tool to get a much more detailed picture and look at the architecture. When you then zoom into this, you can see clear features of a melanoma. So using this machine, we've managed to identify early skin cancers and melanomas that I just don't think we would have been able to identify otherwise. The mole mapper session takes about 45 minutes to do. It involves a series of very detailed photographs, and then the moles that we're more concerned about will have a more detailed analysis with our demoscopy camera as well. At the same time, you'll have a skin specialist that will come along and tell you how we're going to treat any worrying moles or skin changes at exactly the same consultation. So everything is done all in one sitting. But the most powerful part of this is actually monitoring going forwards. And that's because this machine will ghost the image of when patients come in a year later with the image of the baseline, and it picks out the moles that have changed or any new moles, and we can focus in on those to ensure that we've got a very scientific way of monitoring the moles.
Hi, I'm Dr. Pradeepa. I'm a consultant ophthalmologist here at the U Clinic. I'm pleased to offer medical retina and cataract services to patients of all ages. I'm also qualified in lifestyle medicine and passionate about encompassing this into eye care. This means that I not only help treat conditions with the latest treatments we have available, but also to look at your overall health and well-being and see how daily habits can be tweaked to protect your vision in the long term.
Cataract surgery, one of the most wonderful advancements in medicine. The most commonly performed operation in the UK, takes less than 10 minutes, painless, can transform one's vision and actually one's life. But I think a lot of people get confused now with all the different lens choices that are out there. And I think we're super fortunate at UVision that we can offer the whole range of lenses.
What we're realizing in our clinics is that when there's so much disconnection between the specialties, the subspecialties actually, there can be like delays in treatment or mixed messages, or the patients can make it frustrated. But if you have everything under the same roof and you employ a more holistic approach, patients really appreciate that, and we are able to offer the best possible care.
I like the fact that we are thinking about things proactively when we're looking after our patients with regard to weight management, in particular focusing on their metabolic health, their hormone health, and looking at lifestyle measures to support them in this journey. And this may be with or without surgery, but from the start through to the end. And even after surgery, what do you think?
So I think surgery really is the final outcome for a lot of people with weight loss. But if you can actually avoid surgery altogether, that's the optimal. That's what we're actually trying to do. And if we actually start to treat these patients at the very beginning, so if they are starting to get a little more lax skin, then why not actually offer the whole myriad of treatments that we have here, so we can actually start doing non-surgical skin tightening for them. So it may be that they may avoid surgery altogether, or the amount of surgery they need is significantly less. And the other big thing for me is nutrition. I need the patients to heal whatever they have, and I think that's where really you come into force.
What's wonderful in our team is that we are multidisciplinary. So we have a nutritional therapist as part of our health team, and obviously my expertise in metabolic health as well. So that has meant that we've been able to support our patients in looking at all of their medical journey and their lifestyle journey.
Hi, I'm Sevenoaks. I'm a consultant plastic surgeon and one of the co-founders of the Clinic. And I'm really excited to tell you about the new facility that we've just opened up in Sevenoaks. We've got 3 fantastic consultation rooms, but more excitingly, we've got 2 bespoke theatres, purely enhanced to make sure that we get the best patient outcomes and the best patient journey through the facility. In terms of procedures, we hope to be doing a lot of facial surgery, breast surgery, as well as body contouring surgery. In terms of facial surgery, we're doing tightening of the upper eyelids, lower eyelids, as well as facelifts, rhinoplasty surgery, and pinning of the ears. From a breast surgery point of view, we are doing breast augmentation, breast lifts, and breast reduction. We're also specialising in doing fat transfer to the breast to increase up the volume with your own tissue. One of the procedures I'm most excited to be able to offer here is body contouring. This is where we can remove fats from various different parts of the body in a really safe way, and then contour the body to give it the best form and shape. We can sometimes reuse that fat in other parts of the body as well. One of the things I'm most excited about being able to offer is combining surgical and non-surgical techniques so that we're offering the most contemporary ways of treating some of our clients. For example, we can do a facelift and combine it with fractionated CO2 laser, thereby actually giving some of the best results possible. We can also do liposuction and at the same time offer skin tightening techniques which can not only remove the fat, but tighten up the skin almost immediately.
The lens technology at the moment is absolutely amazing, and there are lenses that can give a range of vision. These extended depth of focus lenses or multifocal lenses can give excellent vision at distance, intermediate and near, which can mean that in a majority of our patients that they do not need spectacles. Not everyone is suitable for this lens, and it's important that you speak to your eye surgeon to work out whether you are a good candidate for this lens. I often get asked, what is the best lens? And the answer is, it's all about the individual. So it's important to take a really detailed history, understand what you use your eyes for day to day, and then after that you can work out what lens is the best one for you.
And I think the other thing to mention is medical management. So for patients who are looking for medical treatment, which we have been able to support patients with, we encourage them to work on their lifestyle and habit change during that journey, so that again, along with the non-surgical treatments, it can lead to a better outcome in the end.
Better outcome in the end, and actually what you don't want is people then putting on weight or not having those good habits after they've maybe undergone all of that treatment.
Yeah.
Whether it's surgical, whether it's non-surgical, but certainly after surgery, you certainly don't want people to take a step back. And I think if we can alter habits, we instill those really good kind of learnings, then it just means that they can carry that on for the entire for the rest of their life.
Yeah.